In the wake of the renewed agitation for the local government autonomy by members of the Nigeria Union of Local Government Employees, the Nigeria Union of Teachers Enugu chapter have organized a rally to demand its independence from the sector. During its rally at the New Haven Primary School, the union called on the federal government to separate primary education from the local government or uphold the present arrangement that gives the state the constitutional right to manage its affairs.
Local Government Council has handled primary education. In the past, 1990s, they disappointed. Teachers were owed up to 1 year plus salaries, let alone allowances and leave allowances. Nothing was coming from them. Now they're agitating again for autonomy. Teachers are not against their autonomy. What we are against is based on the experience of the past. Let them not manage primary education and let them not handle teachers' money at all. Memos we have met with the national houses, National House of Assembly and National Senate, and they're giving us a strong promise that they're going to help us execute it and put it into bill that will be passed, that will see the light of the day. Because they have already done it to tertiary institutions.
Staying in the southeast, the Anambra State government has allayed fears of Lassa fever virus in the state. The Commissioner for Health, Dr. Joe Akabuike, explained that a patient was taken to the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital in Noka with a history of fever and bleeding. He says that the patient has been transferred to the Lassa Fever Institute in Edo State for further analysis.
The State Ministry of Health, especially the epidemiology unit, has commenced the identification of contacts with the patient, and the total of 63 people were identified. 31 of them are mainly workers, are mainly health workers and students, and they are classified as high risk. They are currently being followed up using the necessary surveillance tools. And 3 of these patients who developed fever have been tested at Tirua and they are negative. We also want to assure the people of Anambra State that the case is fully contained and we have not had any other case, and the people that were following up are doing very well. Today is the 2nd week of the follow-up of all the isolated cases, and they are doing very well. It's very, very important that our people also have to go back to the current call of the government to improve our hygiene, both the environmental, immediate environment and our homes, particularly the things that has to breed rats and other contaminants that may lead to Lassa fever infection.
Following findings conducted by the National Deworming Program of the Federal Ministry of Health in collaboration with the World Health Organization, it showed that 22 local government areas in Rivers State have very high levels of parasitic worms in children. Over 1.6 million children are expected to be dewormed in an ongoing exercise by the National Deworming Program and the Rivers State Ministry of Health. The coordinator of the program said that 6,000 teachers have already been trained for the exercise to ensure that all children are reached using the schools as a contact point.
Over 6,000 teachers have been trained across the state, at least 2 teachers per school, and are supposed to also brief other teachers working with them in the same school to be able to make sure that every school-age child, whether attending that particular school or not, should be reached within these 5 days. And we also hope to carry out a mop-up exercise to make sure that we reach out to every child in Rivers State.
The children are the most affected when it comes to the warming, because you see them go on break for 30 minutes, they come back. You know, most schools don't have water, so they don't do this hygiene of washing their hands. They come in like that and put their hands in their mouth, picking things here and there, and filling their tummies with these worms. And you find out that that it is just the best to use the schools, you know, to do this deworming exercise.
The National Primary Healthcare Development Agency, the agency in charge of primary healthcare, is pushing for a system reform to strengthen healthcare system in Nigeria. At a meeting with journalists and civil society organizations in Abuja, Nigeria's capital city, the executive director of the agency says he is carrying out a system reform that is to revitalize primary healthcare as well as routine immunization. He attributes the spate of disease outbreaks that the country experienced recently to weak immunization system, which reforms he hopes would address.
When the Ministry of Health released the 2016 National Health Facility Survey last month, inaccurate diagnosis and the lack of basic treatment drugs and equipment, especially at primary healthcare facilities, were identified as major challenges confronting the nation's healthcare system. This meeting between the executive director of the National Primary Healthcare Development Agency, civil society organizations and journalists in Abuja is organized to provide explanation to some of the failures in the system and how the agency plans to address them going forward. First, the executive director of the National Primary Healthcare Development Agency explains the reasons behind a series of disease outbreaks the country experienced recently.
What our data shows to us is that routine immunization is not as good as it should be. Less than half the population of eligible children are getting the vaccines that they need to get. That is just the truth of the matter. It's not a question of trade blaming. It's a question of how do we deconstruct, how do we unpack routine immunization and address the challenges. That's what we're going to prioritize at NPHCDA.
Dr. Shuaib also states how he intends to reform the agency, including that of decongesting the headquarters in order to change the narrative.
Most of our populace live in the rural areas. So instead of having most people at the headquarters, we've identified senior and very experienced directors to move to the zones as zonal directors so that they can engage with governors, they can engage with traditional leaders and solve problems without even coming to Abuja.
It's been argued strongly by healthcare experts that the strength of any nation's health depends on the primary healthcare system. Hence, participants in this conference hope to see how the primary healthcare agency will match its words with action.